Today we are doing our Lunch and Learn series on the AgriStress Helpline, and it's a resource for farmers and ranchers, and we'll specifically be talking about the AgriStress Helpline here in Texas. So today we are joined by AgriSafe Network for today's webinar, but Texas AgriBility, my name is Mackenzie Thomas, and I'm the program coordinator and co-PI for the Texas AgriBility Project, and we are funded by the USDA National Institute of Food and Agriculture through the Texas A&M AgriLife Extension Service. We are partnered with AgriSafe as well as the Brazos Valley Center for Independent Living to assist farmers and ranchers with disabilities, and AgriBility is also a nationwide network of projects that are geared towards assisting farmers and ranchers with various types of disabilities and health conditions. So our goal is to provide services to individuals with disabilities, chronic health conditions, and functional limitations in agriculture. So, like I said, today's webinar, we're joined here by AgriSafe to discuss the AgriStress Helpline here in Texas. And it's a great resource for farmers and ranchers, as well as for lay people or individuals that are working with farmers and ranchers to be aware of and kind of know about. That's kind of a newer resource. And so today our presenters are Natalie Roy and Tara Haskins. Natalie Roy grew up on a farm in New Hampshire and has dedicated her career to rural public health since obtaining her master's in public health from Tulane University. 20 years ago, Natalie assisted a corps of rural nurses in the formation of AgriSafe Network, a national nonprofit that integrates public health principles in the delivery of occupational health services and trainings. Public health innovation is a cornerstone of her approach in her 20-plus years leading AgriSafe. Natalie's responsibility is to prepare AgriSafe to rapidly respond to emerging public health issues and leverage thought leaders in a strategic response. And so you can see Natalie there on your screen, and then I'll go ahead and introduce Tara Haskins as well. So Tara Haskins, as AgriSafe's Total Farmer Health Director, Dr. Haskins is passionate about rural communities and the healthcare professionals that serve them. She lives in Shreveport, Louisiana. Dr. Haskins has 35 years of experience as a registered nurse with over 17 years in healthcare education. She's a 2018 AgriSafe Nurse Scholar. She holds a master's in psychiatric mental health nursing, a doctorate of nursing practice in forensics, and is a board-certified advanced holistic nurse. As a National Rural Health Association Fellow, she worked to co-author NRHA's Disaster Preparedness in Rural Communities policy paper. As a NRHA member, she regularly advocates in Washington for policies to improve rural healthcare delivery through NRHA's Policy Institute. With rural roots, strong clinical background, and a holistic healthcare philosophy, her goal is simple: create health opportunities for well-being that creatively navigate barriers and build on the strengths and therapeutic way of life that already exists in rural communities. So I just wanted to thank you guys for joining us today for our webinar and kind of educating individuals here in Texas about the AgriStress Helpline and what you guys can provide.
Great. Well, thanks for having us today. Here at AgriSafe, we're really proud to be have launched the Helpline, which is a crisis line for farmers and ranchers in Texas, and really happy to share this with all of you because we really need your help in promoting the line throughout the state. Just to let you know a little bit about AgriSafe, if you're not familiar with our organization, we are a national nonprofit, and our mission at the end of the day is to protect the people who feed the world. It's a big challenge, obviously, because agriculture is so diverse, and we care about both the body and the mind of the farmer and the rancher. So there's a lot of work to do. As you know, working in AgriBility, there's a lot of health disparities that farmers face, and it's hard to do this work without partnership. So the first thing we're about is creating partnerships that really allow us to advance our mission as well as bring value to our partners. I'm very happy again to work with AgriBility in the state of Texas. The other area that we work closely in is recognizing that we have a responsibility to serve. That means that if there's an emergent issue or we see an opportunity where we can be helpful, AgriSafe is going to be really the first to step ahead and say, okay, what's being done about this? A great example of their work in the opioid epidemic. We know opioid misuse and deaths by opioids have risen throughout rural America, and that's a great example of how AgriSafe's responded specifically to how it's impacted farmers. So I just want to throw that out there to let you know that we are talking about the crisis line today, but we've got a lot of other program areas, and I hope you'll check out our work if you're not familiar with it. And finally, we really feel that as a nonprofit, we need to be innovative in how we approach public health problems. And so our Helpline model that we're going to share with you today is an example of that innovation. Okay. So a little bit about why we do this work. You know, in terms of the mental health side, many of you probably know that farmers face a lot of stressors, and really, you know, whether you're in the Northeast and you're a dairy farmer, or if you're in the West Coast and you're dealing with a natural disaster like fires or wildfires, the stressors in agriculture are so unique. And for those who live it every day and are trying to balance the family farm as well as factors like low commodity prices, again, natural disasters, workforce shortages, maybe an injury or medical event. We know that farmers and ranchers do a lot of this work alone and try to navigate the stressors that come to them. This picture here shows you, you know, an example of how the mental health of a farmer can be impacted. Even, for example, with sleep, we know that unfortunately, you know, when it's time to bring in the harvest, you don't have a choice. You're going to bring it in, even if you've got 2 hours of sleep. So we know that farmers and ranchers face unique stressors. And we also know that it's very hard to connect with their needs unless you appreciate the work they do. And that's what this helpline was designed to do. The slide that I'm sharing with you now, the one with the natural disaster, is just one example of many stressors that we know is real. This was actually a winter flood in March in 2019 in Northeast Nebraska. And AgriSafe, we had done a lot of work in the flooding, flood response. We specifically were concerned about when a farm floods, you know, what does the response look like from FEMA and other agencies? Are we being proactive in looking at things like well water contamination and such? But certainly what it does, the mental health toll that it does for a farmer after the event is significant. And this picture really shows a lot. This was actually the reason why this is so significant. This was a winter flood. Now in Texas, I'm based in Louisiana. You know we have a lot of hurricanes come through, and certainly, you know, Texas is not without their hurricanes. And so we know natural disasters continue, and yet at the same time, like, we're very concerned about what does the response look like for them after an event, and are people staying safe both in their mind and their body. Another example of a natural disaster, I mentioned it earlier, is, you know, the wildfires. Like, you know, we found it interesting that, like, a lot of the guidance when there was wildfire was, okay, make sure people stay indoors. Well, anybody that works with a rancher is going to know that you're not going to tell a rancher to go indoors and then ignore their livestock that they've dedicated their life to protecting and raising. So, you know, we really try to be relevant to the farmer. And that's why we felt that over the years, looking at what they had for crisis response and the ability to talk to someone when in crisis, we found that there was a lack of appropriate services on a 24/7 model. So my colleague Tara Haskins is going to explain a little bit about why it is, you know, this helpline was developed and what basis it consists in terms of the best practices. So I'm going to turn it over to her. All right.
Do y'all want me to go ahead and share the poll to kind of gauge where our audience is from?
Sure, perfect. Yep.
Well, you should see it. I'm going to try to launch it right now. You guys may see it in your chat, or it may come up over the screen. But just select all that apply, like if you're a veteran or you work in healthcare field, farmer rancher, ag service provider, beginning farmer rancher. So you can just check any that apply to you. That way we kind of gauge where our audience is from. And then give you a couple minutes to do that while they kind of switch. If you have trouble seeing the poll, please let me know. I'm making sure y'all can see it. I see some people are answering, so it looks like they're responding. So it looks like about 40% are military veterans. We have some beginning farmer ranchers, some individuals with disabilities on, as well as ag service providers kind of joining us today. And I'll leave that open for a little bit if y'all are, if you'd like to respond and kind of tell us a little bit about where you're from. Also, feel free to use the chat or the Q&A if you guys have any questions, and we'll be monitoring that as we go. I'll go ahead and turn it back over to y'all.
Okay, great. Can you see me okay? We readjusted the height of the desk, so.
Yes, ma'am.
Okay, great. Well, thanks, Natalie. That's a great introduction into sort of the context of the importance of a resource like the AgriStress Helpline. And so today I'm going to go over some information for you that will kind of give you an idea of how this is an innovative helpline model specific for a specific population, agricultural communities. And I'm also going to give you some idea of how that helpline is manned and what is required in order to be able to answer that helpline. And then we're going to talk about the process of when a caller calls in, kind of what they may experience as well. And then Natalie certainly is going to finish up today with talking about our vision for an expansion of this helpline. So this helpline was always envisioned to be a national line, but we decided to kind of start with state to state. And the great state of Texas was one of the first ones in line to say we want this service, for our farmers and ranchers. All right. So the AgriStress Helpline was launched in February of 2022. It was launched with 4 of these states that you see in front of you: Texas, Wyoming, Pennsylvania, and Virginia. We added Missouri sometime in late summer of 2022, and then Connecticut just came on board as of December. So the AgriStress Helpline is 24/7. It is call or text. And it can be individuals that call the line can be communicated in up to 160 languages. And that's because our high-level performance provider for this line has access to the telephony system that allows them to be able to get interpretation services in 160 languages. That was a really critical piece for us because we knew that the cultures within agriculture are very diverse. And also with the large migrant farm worker population that we have, that is not only those that are from Mexico or other Latino countries, but we also have a lot of Vietnamese and other representation, across agriculture across the country. And so the number that you see before you is the number for all of these states, all of these 6 states. An individual that calls that number gets our service provider via link. AgriSafe is not answering these calls. We knew that we needed individuals that knew the evidence-based practice in helplines and also came ready with all of the accreditation that we felt like was critical in order to provide a highest level of service. And so the number, anyone that calls this number is going to get our helpline staff, which is provided to us through via link. And that would be call or text. So before you is a marketing card that we have in the state of Texas. This marketing card was developed in collaboration with the Texas State Department of Ag, as well as the Southwest Ag Center that is in East Texas at the University of Texas. You can look at this picture and I think immediately to your mind, this looks like a farmer or a rancher in Texas. And that was really important for all of our marketing pieces. And so we get a considerable input from the state departments of ag and whoever is working in those states to develop the marketing pieces to get photos that are representative of the ag population, the ag workers in that state. Agriculture is different across different states. And so a farmer may look very different in Pennsylvania versus a farmer in Texas. So the QR code that you see on this card, when you scan it, it actually brings up the number to the AgriStress helpline and allows you to store that in your contacts. And so we felt like this was really important. It's easy. You don't have to memorize the number. People can go ahead and scan it and get that loaded in. And so if they ever need it, or if they find they need it for a friend or a family member, they can pull that number up pretty easily. So now I kind of want to talk to you about some of the way that this helpline works. I do want to emphasize that this helpline was in process of being developed and modeled 2 years before we actually launched in February of 2022. And I think that that sort of underscores the amount of work that we put into this, the consideration. We met with a lot of partners. We met with experts in agriculture, agribusiness, psychology, to really pull together the best minds as to if we could dream the best helpline for people in agriculture, what would that look like? And that's what we have here in front of you. So and under our best practices, I have a few things that I do want to highlight. Our crisis calls are handled by a provider via link who is accredited through the American Association of Suicidology and is part of the National Suicide Prevention Lifeline. That's really important because we know that they have to meet some of the highest of standards. And they do this through customized lines. So we wanted a provider that would be willing to work with us to make this really pertinent, to be able to collect the information we needed to collect on calls, so that we could get a good picture of what's happening across the state and hopefully eventually some point across the nation. So those individuals that in order to answer the calls, they have to go through about 300 hours of training that allows them to be a crisis specialist on the other end of that phone call. And then in addition to that, AgriSafe provides the cultural context and agricultural training that gives that crisis specialist the ability to respond appropriately, to understand the stressors that are in ag, to understand what the barriers are so that they're not recommending something or leading someone to a solution that may not really be well received by that person on the other end of the call. And we do that in several ways. So before an individual can answer the AgriStress helpline, they, number one, complete all of the lifeline trainings that allow them to be able to answer suicide calls and provide crisis intervention for those suicide calls, assess and intervene. And that is the initial primary purpose when someone gets on that line. That's what we're looking at. We want to make sure we address safety. And then all of those specialists are required to complete farm response training. I'm going to share that with you a little bit later. This is a very specialized training that AgriSafe developed in collaboration with other ag professionals to give them the context. It's not an hour training, it's a 3.5 hour training. And we feel like it does a really good job of giving an overall picture overview. And then all of the calls are supervised by a point person. All the calls are listened to. Crisis specialists have access to someone at a higher level supervision if they need help with a call. And all of those points were really, really important to us. The individuals that are answering the calls may come from a varied professional background. Many of them have some degrees in social work, but they also may have degrees in counseling and certainly a degree in psychology. Then they have received the specialized training through B-Link that is required for them to answer the lifeline calls. And then they are required to complete the farm response training. And on a regular basis, AgriSafe provides them continuing education, to further develop. So AgriSafe loads on a very special platform for them additional webinars or information that they may need in order to further hone their skills and understanding of ag. For example, we have one there on dairy stress. We have a webinar that talks about veterans and what it's like for them to return to farming and what the stressors that they may encounter. And those are all separate from farm response, and they can pick and choose those, maybe either based on their interest or maybe on the types of calls that are, coming into the call line. And then, of course, ViaLink maintains all of the accreditation, all of the documentation for that crisis staff, so they can continue to answer those calls. So it's a very robust training process. And they always are getting coaching from that point person that's their supervisor there at the call line. So in collaboration with those ag professionals, which also included people that had specialty areas in psychology. We had a psychologist work with us. We wanted to develop this call flow, and then we vetted this call flow through ViaLink. So this has gone through several individuals. And so you can see that either a call or a text might come into the line. It can be answered in 160 languages. You can see to the left-hand side the accreditation that ViaLink maintains in order to provide the highest level service. And as an additional accreditation, they are also accredited by the Alliance of Information and Referral Systems. This is known as AIRS accreditation, and this is an accreditation they maintain that helps them to vet any resources or referrals and have a process that those are checked or revetted on an annual basis. And they're checked, they can sometimes get sort of like secret shopper people to come in and check, make sure all those links work, that they're giving to a caller, the numbers are correct. That was really important to us too. The call staff are provided a database of referrals and resources. Some of these, a large portion of them, are state specific. So we have mined all of those resources in the state of Texas, both agricultural resources as well as mental health resources. So we have things in there sort of like the disaster line number that you might recall in the state of Texas. If there's a number that you need help finding farm workers, that number is there. If you are a migrant farm worker and you need legal assistance, those kind of things are in there. And the hay line, if they're in a drought season and they're having a hard time feeding their livestock and they need to find emergency sources of hay. So we really think broadly in any of the resources that they may need in order so they can run their production, decrease the level of stress, and keep them moving forward. And so at the bottom, you can see a lot of the types of resources that we have. We have substance abuse resources that are state specific, financial mediation resources that may be available to them. And also we do use 211 because that's quite robust in terms of housing, assistance with paying bills, things like that. When a caller calls in, we try to identify if that individual, if they're a farmer or rancher. And we're expanding this line into fishing and into forestry. So we have categories that the call line can check that box. But first and foremost, that call staff is going to establish a relationship with the caller, see where that person is, make sure that this is not a safety issue, do a brief suicide assessment, and then move from there to next steps. Some callers call and they just want resources. There may be third-party callers. An individual is concerned about a family member or is looking for resources for a family member. So those types of calls may come through. And then the calls proceed according to where that person is. And if they are open to receiving referrals or resources, those are offered. An individual is offered at least 3 resources, and they are all callers are offered a follow-up call in 24 hours. They can either decide to accept that call or not. And that's offered to both a person that may be in crisis or needs the resources for themselves, as well as those third-party callers like family members or friends that are concerned about them. Okay, so So that is sort of the flow of those calls. And now I'm going to kind of move forward and tell you a little bit. Oh, and let me just back up because I do want to share one other aspect of this model that is not reflected on this flow, is that AgriSafe works really closely with the State Department of Ag, which we are providing this service for, and we communicate on a regular basis with our VLink rep. So I meet weekly with that individual that is listening to the calls, watching the call volume, pulling those reports. We communicate any media events that happen in the state, because obviously a media event could generate more calls. And the helpline staff needs to know that to see if they need to build up staff maybe for that several days following the media event. We also communicate in the other direction. If the helpline is getting calls on a certain topic, and maybe they need more resources for that, or we see a trend, we communicate that information from VLink back to the State Department of Ag. So think of this relationship as really like a communication ring between the person that has the department that has contracted for the services, the State Department of Ag in the state of Texas, and AgriSafe and VLink. And this really provides, I think, quality service. It also allows us to recognize and respond quickly to trends that are happening on the helpline. Okay, so now I'm going to share with you a little bit about Farm Response. Farm Response is that foundational training that the VLink staff must take and complete before they can ever answer a call on the helpline. But Farm Response, it was designed in mind to train healthcare professionals to understand the mental health stress factors that exist so that they can respond appropriately, whether they are an occupational therapist, a nurse, a social worker, a behavioral health specialist, somebody that works in drug and alcohol treatment, a primary care provider, a pain physician. We developed this training to kind of cut across all professionals, any individual that might have a touch point with somebody in agriculture that may be exhibiting or stating situations or issues that are creating stress for them. So it brings that healthcare professional up so they don't have to ask as many foundational questions, which can sometimes be frustrating to patients, but it gives them an understanding and a context. This is 3.5 hours. It's on demand. AgriSafe, through the funding through the State Department of Ag, launched this, and to date we have met all of our deliverables in your state, and we've trained 277 healthcare professionals in the state of Texas. These are other states that you see in the national map in green that also have seats. We see this and we are pushing this out nationally. We want to get as many healthcare professionals trained in Farm Response as possible to saturate the nation with available practitioners and professionals that, can help individuals in ag when they seek out their services. This is accessed through our website. We no longer have free seats or funded seats available in Texas, but you can take Farm Response and it's $150, and you can access that through our website. We're really excited to date. We have trained over 600 individuals across the United States in Farm Response, and we across about 36 states, including Hawaii and some in Canada. So we've gotten a really, really good response. We are now completing our 1-year evaluation data that will include 500 learners in that. So we're looking forward to that. And our future vision with Farm Response providers is that AgriSafe would like to launch a healthcare professional directory on our website so that the public could come in and search for a Farm Response a provider or a healthcare professional that is certified in Farm Response, and to see if they are closely located within their area. This will be searchable by area, by zip code, by mileage, as well as offer things like what kind of coverage they take. Are they taking patients? Do they provide telehealth services? So we really see this as a very important service to help individuals find a provider that they feel like can meet their needs. And so now I'm going to turn this over to Natalie. Natalie, is there anything else I missed?
No, I think we're good.
So let Natalie finish this up.
Thanks so much. Hey, I'm gonna go, excuse me, back just a couple slides. So we, make sure y'all can see that. So the slide I have up now that Tara showed you all, this shows you like what a promotional digital piece might look like, in terms of promoting the line. And so my ask to all of you that are on this webinar is to think about what you can do to help us promote this number, because the way that it works is you can't just, I gotta put my desk down a little bit, sorry. We can't just get the number out there once and then think the people should be able to remember that. So we need the help of folks that are on today to think about where they can place that number in their communication. So the slide that you see now, if you scan that QR code, it will take you to a form where you can request printed marketing materials sent to your address. So these are things like posters, business cards. So the NIOSH funded Ag Center based in Texas is the one that's going to fulfill that order, and they're going to go ahead and get you actually printed materials. So that's a really excuse me, great option. So you'll get the print materials. Now, if you're interested in any digital materials to help maybe put on your website, or if you send out a newsletter, I'm going to show you where you can find that. That's on our website. So the big ask today is to think about ways in which you can carry that number forward. Now, you don't need to worry about including 988 with this, because this number is a 988 number for farmers, meaning that the people, as Tara explained, the people answering the line also answer for 988. So they have the ability to provide the same level of service. If somebody calls the helpline number and they don't fit in this perfect, category of a farmer or a rancher or someone who works with a farmer or rancher, their call is not going to get turned away, because when someone's in crisis, you have a duty to respond. So there's not a risk to us. We're not worried if someone calls, it's not the, ideal user. So don't get concerned about that. If you have communication with the ag communities, it's really important to get this number out there. I'm going to go ahead and show you here what we've developed. Is called the AgriStress Response Partnership. And so we are looking for partners who pledge to respond by promoting the helpline, by working, in their region or in local communities. In this partnership campaign, while we'd like to see in the states that have the helpline, we'd like to see partners really engage with us to get the number out. We certainly know that the great work that's being done at the local level needs to be really communicated. So this partnership is a way to bring people together. So if you're doing work on one part of the state of Texas, through this partnership, we hope to connect you with other folks. That's what AgriSafe does, is we do connect on a national scale, but we also know there's great ways to connect within the state. So this is another QR code we're sharing with you, and this is to become a partner in this really national movement for what we call AgriStress Response. If you join as a partner, what you get in return is you get that digital badge there that then you could use as well to show that you stand behind response to farmers. So it's another way to engage folks in a partnership on these efforts. So please think about, if you represent an organization, joining as an AgriStress response partner. That would be really awesome. Let's see. And then the other thing I want to make sure you all know about too is that every month we have excuse me, what we call mental health innovation exchange, and those are free opportunities to just come together. We work really hard to find these real great work being done on a local level across the nation, and work being done to address the mental health disparities that farmers and ranchers may face. And I think from these experiences, you may find some really great ideas to move your programs forward. So that's another QR code. Check that out. Again, if you've missed some of them, you could, they are every month. So we really do have quite a range of presenters. Also, if you're doing some work that you want to share and share those best practices, we're always looking for presenters as well. So we'd love to hear from you. I'm going to go ahead and actually jump to the website. Excuse me. And I want to show you how to navigate our website because there's quite a bit on there.
If anyone has any questions, as you're kind of thinking through, please feel free to include those in the chat or the Q&A, and we'll be sure to get to them at the end as well.
Muted. Okay, so hopefully I'm showing you the screen that shows the business cards that we've developed.
Yes, ma'am.
You can see those. Okay. So these business cards are like ready to go, ready to download. And if you can get them printed, they're, front and back, obviously, all the digital work is done for you. So if you have the ability and the funds to print those out, this would be great. As Tara said, on the back side, we actually have the scannable QR code so that someone doesn't have to sit and write down a number. They can have it in their phone. And that's what we really encourage people to do, is have the number ready, because what you don't want to do if somebody is in need, you don't want to be trying to find that number, remember that number. So have it in your phone as part of your contacts. And we encourage people who they may not be in crisis themselves, but or have a loved one that they can call on behalf of someone else. So doesn't have to be the individual calling. To get access to all the digital material that is free to access, I'm just going to show you how to do that here. Am I showing the website? Show you that
yes,
screen?
ma'am.
Okay, I'm still at this. Okay, want to make sure I haven't jumped around to a lot of different. Okay, so you're at the helpline within our website, the helpline page, and you can learn a lot more about how the program was designed. We've got videos from the folks feeling who provide the crisis response. So if you want to do a really more in-depth study of like, okay, how did they build this out further than what you heard today, you're going to find everything on this website, including, again, how it's different from 988 as an example. If you're ready to get involved and you really want to help push this number forward, which I hope many of you are, then you're going to come to this part of our website and you're going to click on View Marketing Resources. So because we have it in 6 states, we have to make sure we've got all the resources for all the states. But what's cool about this is that you can sort by state. So you can come here and pick Texas, and you'll get all of these files here that can be downloaded, like the business card I showed you, are all accessible from this site. So if you want the logo, if you want a postcard size, if you want a poster, these are all digital files available to you. Again, if you access these and use these, that really helps us carry that number forward. Also, again, you have the ability to also request the materials being sent to you as well from the NIOSH Ag Center in Texas. So there's 2 ways to get this. So please check that out. And I'm going to go ahead and just go back to this screen, just kind of like where everything is located. Just pause my screen there, and then we're going to see if there's questions.
I don't see any questions in the chat, but feel free to, if you have questions, stick them in the chat. I've also, believe I've enabled it to where you can unmute your microphone if you want to verbally ask a question. Let me go ahead and check the Q&A. I don't see any posts in the Q&A either, but feel free to leave any questions there as well.
Okay, I'm gonna also just show you all how to find information about farm response. 'Cause I know Tara's had talked about that today. So under current projects, if you go down to farm response, you can find information about that particular training. It was extremely popular in Texas when we announced when it was announced that those seats, the free seats were available. Within a 24-hour period, we had like 1,300 professionals reach out to take this course. And so there were a lot more requests for it than there was actually seats that were paid. So the seats got filled up fairly quickly. But I know that the Texas Department of Agriculture, maybe look at other ways to fund more seats. And as Tara mentioned, the long-term goal is to have a really great network so that when people call the helpline, we have folks that we can help refer to that have invested in farm response. Now, there's other courses out there that also can help the therapists really relate to the farmer, and we're happy to promote those as well. So if any of you are have resources or you have services that we should know about, please let us know, because our job is to continually bring resources to the crisis call specialists so that when someone calls, they're ready to give them the best responses that they can and the best resources. A great example was there was the drought in Missouri, and a lot of the calls that came in for this from the state of Missouri were folks looking for resources and how to respond to the drought. And so we had to quickly gear up and figure out, okay, what was available. So if you all feel like you've got something that we should be putting into our queue for resources, please reach out. See if there's any questions here.
I didn't see anyone putting anything in the chat, but I did have a question. So I know some people on maybe from other states. If you're not from a state that's kind of listed in, if it's not from Texas or those other 4 or 5 states, are they still able to call the helpline, and kind of how does that work?
That's a great question. And so the way that it works is that we're asking folks not to promote the number in states other than the 6, because the funding is available only to support calls from the 6 states. But if someone were to call from California, for example, which is not one of the funded states, we have a responsibility to answer that call and to service that call, because you can't leave someone in crisis and say, well, let me transfer you. So we're in a sticky situation. So this brings me to the point about the national line. We know the sooner that we can move this number to a national crisis line for farmers, the easier it's going to be, because farmers and ranchers don't think by state borders necessarily. And it's very difficult to be a public health organization and to say, hey, don't promote the number when we want usage, we want farmers to rely on it. And so we know that we have to start with these 6 states as a pilot, but our hope is that the next year or so that you'll see this number carried through on a national scale, and so we can service farmers, ranchers on a national level. That's why all 6 states that have the crisis line have the same exact number, because we don't want them to invest in marketing and then have to turn around and take that number away and say, okay, here's a new number. It's hard enough to get people to remember this new one. So that's the long-term plan. If you are from a state that does not have this funding for the helpline and you're interested, we can also add states before the national roll-up. So feel free to reach out to us.
Thank you, Natalie. Did anyone else have any questions? I believe you can unmute your mic as well and ask a question verbally. Oh, I see Sine is raising her hand. Let me see if I can Danae, I don't know that I can unmute you. If you're not able to unmute, feel free to leave it in the chat. Or you can also put it in the Q&A section.
I'll go ahead and put my email back in the chat too, just in case anybody wants to reach us. We're a fairly small organization, so don't feel like it's hard to contact. Sometimes actually phone calls are easier than emails if you'd like to do that. So I'll include my phone number too.
Oh, Sine asked, any word on the funding for the continuation in Texas?
That's a good question. I think Texas of all the 6 states is probably the best position because you have in your you have legislative language in a bill that says that there's authorization for the Department of Ag to run a crisis line. So it's whether the state appropriates dollars each year is a different story. So I think Texas is in a good position. We're looking at the line running through July of 24. So they're probably the best position than all the other states because they are putting additional dollars towards continuing the line. So yeah, so I think that things look good for Texas. Certainly, if, just so you all know, the idea is that if it goes in a national line, then the dollars that the states have been using to operate the line can go into marketing the line. So it's not that the funding would need to stop if there was national funding for a line. We really would love to see dollars go to state partners. AgriSafe, we really want to stay in the business of servicing the line and not marketing the line. But we also know that if farmers don't know the line exists, it's going to be hard for folks to call. So the answer is yes, there's funding for Texas to continue the line through July, but the dollars for outreach and marketing are not probably where they need to be. So that's why it's really important for organizations to think about any creative ways to promote the line throughout the state.
Awesome. So is this something that's being considered for the Farm Bill?
Great question. Yes, there's lots of interest in the Farm Bill in terms of separating some dollars. So instead of being sort of vague about this hotline concept, but to put dollars towards a crisis line. And so that's definitely on the table because the Farm Bill is going to get to be really complicated and probably won't get finished this year, and we'll move into next year. There will be temporary appropriations, and it would be ideal that dollars that would kick in this fall, that they would include dollars for a national crisis line. And to actually run a national crisis line for the operation of the line is about $2 million. So that's actually not a lot of money when you think about it. Right. For a national call line, $2 million a year. And again, that doesn't include the outreach and communication piece. So that it should be really at least a 1-to-1. So if you have $2 million to operate the line on a national level, you should have at least $2 million set aside that will be granted to the states and different organizations and groups to do the awesome work they do on the grassroots level.
Awesome. Did anyone else have any questions? It looks like maybe the mic unmuting things, it might be an issue, so feel free to either use the Q&A or the chat box. I did want to ask too, if y'all have you seen any results as operating the line for, I guess, about a year now? Kind of what have you seen as a result of that?
Yeah, that's a great question. And I don't know, Tara, if you'd like to answer that. I think maybe some of the stories,
sharing a couple stories from Texas, or even if they're from the other states, it could give people perspective on
Oh.
some of the experiences on the results of the line.
Sure. So we monitor the line usage on a monthly basis for each state. Texas has certainly done a wonderful job of with press releases. Their commissioner is extremely dedicated to promoting this and has done some great PSAs, which is really critical, I think, for the use of the line. I think ag producers in the state need to see those point people that they trust and that they recognize in the state saying, hey, this is here for you. And he's done a good job of that. We've had, I think on our, well, I can't navigate Natalie's computers, but we do have some success stories that are on our website. As I said, some individuals were calling. I think we had one that was a farm worker, and we have to de-identify any stories that we put out there on a, in a public view, because there is a level of protected information that we don't want to distribute. So any story you see on our website, let's see, Natalie, go down. Let's see any stories that you may see. Maybe it's on the next page. Are going to be de-identified. We've had we had a caller that called us from California on behalf of somebody in Virginia. And I think that story underscores the importance of this being a national line, because these state boundaries really make it challenging, to navigate. Now that call was answered and that person was certainly served and was provided emotional support and resource support. Maybe it's something that can get involved. Let's see. Well, I don't know. The stories were there at some point. So we do have some stories on there with regards to an individual that was a farm worker. When I look at the metrics every month, I see a lot of not enough funding, not enough funds or financials to, purchase the inputs, the seed, the gas, those things that they need in order to do the work that they do. A lot of stress regarding that. They certainly work with their own farm lenders that they have in their areas, but they're calling the line, and those are some of the stress points that they're sharing. We have had individuals that have been identified as having some suicidal thoughts. We have yet to have to deploy a 911 to a caller yet, but those individuals were certainly, their needs were met through emotional support. And I think that's really an important distinction. There are a lot of individuals that may be in crisis and that may be thinking along the lines of suicide, but that emotional support can go such a long way of keeping them out of the hospital, keeping them out of emergency services if it's provided at the right time. And that emotional support time on the line is not limited. Individuals can call every day of the week if they want to and receive that level of emotional support. But certainly all solutions are explored with that individual. Somebody calling into the line that may be in a mental health crisis may not, they may not be needed to have emergency services deployed, but they may not be at the point where they're ready to connect, say with a provider or with a resource. And that's why that 24-hour follow-up call is really important. And we try to stay abreast of anything that's happening in the state. For example, when the tragedy at Uvalde occurred, we knew that those individuals living in that area, many of them were involved in agriculture. And so we wanted to make sure that they had access to the line because it could provide emotional support services. I don't think we had anybody call from that situation. There was a nice deployment of resources and services down to Uvalde face to face. But, those kind of things, a response to a stressful event doesn't have to be ag focused. They could just be experiencing personal distress, and they live in this ag community, which can sometimes bring other layers of stress that are very unique for those communities.
Thank you so much, Tara. That's very neat to see, kind of the impact that the the line has had so far, and hopefully something that we can kind of continue. I did want to go ahead.
Add one more thing to that too. So measuring impact is really complicated with crisis line, because when someone's in crisis, we can't do a survey afterwards or say, hey, did this help you? Tell us how this might help you, because we have to, our primary goal is to service the person. And so from an evaluation standpoint, it's hard to know, okay, how we save lives. Can we say that this line has already saved lives? Well, it's very subjective, and certainly we're not going to go back and when we call the folks that have been in crisis, it's because we're calling them for follow-up to make sure that they're okay and provide support. It's not to do a survey on, did we change an outcome? And so, I think over time, the more data that we get, especially on a national rollout, we'll be able to have other metrics to tell us whether or not the line is doing its job. And I really think that from a cost standpoint too, is it worth having a special line for farmers if it saves one life a month, or one life every year? And that's very subjective to folks, but we want to make sure everybody understands that this is a crisis suicide prevention line first and a resource line second. And it is meant for 24/7 coverage, because we know when someone's in crisis, they're not going to just, call a number and be done at 5 o'clock in the afternoon. And so this is what distinguishes this number from other hotlines that exist.
And in terms of the value that the line provides, not only is it saving lives, but it's also keeping individuals from having to enter to get mental health care, maybe in an emergency type service, which is oftentimes emergency rooms. Even they serve a wonderful purpose, and it's fantastic that we have them, and they can be an entry point into higher level mental health services. But it's oftentimes not the best place to really connect with somebody, to share, what your pain is about and the issues and struggles that you are experiencing. So, as Natalie said, it's hard to measure that. But if you work in healthcare, the cost that entails. It not only is a financial cost, but it's a cost of time. And so if we can keep individuals out of that system and keep them at home, keep them working, which is really where they want to be, okay, and connect them, then that's a win. That's a win overall.
Absolutely. And I just want to thank you guys for kind of pioneering this. I know that this is kind of something that y'all came up with and have pioneered the helpline and found partners and people to man the line. So I think it's really important work, and appreciate what you've done for the ag community and just kind of removing the stigma around accessing mental health services. And hopefully with some of the people on the call today, we can help get that information out to even more people, especially here in Texas. So thank you.
Appreciate it.